Hello, my name is Yula Kim from HIMSS, and welcome to today's webinar. Thank you for taking the time to be here today. We have an exciting program for you, but before we get started, I would like to highlight a few things so you know how to participate in today's events. At the bottom of your screen are multiple application engagement tools you can use. All the engagement tools are resizable and movable, so feel free to move them around to get the most out of your desktop space. If you need technical support during today's events, click the question mark icon in the navigation menu at the bottom of your screen to find answers to frequently asked questions, or you can type your questions in the Q&A widget to the right of the media player. You can use the same box to submit questions to the speakers at any time. And if you don't get to your questions today, we'll follow up with you offline. Engage with today's content and let us know how you're feeling with the emoji reactions. If you miss anything, don't worry. You'll receive an email within 24 hours with a link to the on-demand recording when it becomes available. So now let's get started with today's program, Boosting Efficiency and Safety, a real-world case study in clinical communication transformation sponsored by Mobile Heartbeat. Our speakers today are registered nurse Kim Wagner, Senior Clinical Systems Analyst, Emergency Department at Richmond University Medical Center, Dr. Jonathan LeBaron, Chair of Emergency Medicine at Richmond University Medical Center, and David Roth, Chief Marketing Officer at Mobile Heartbeat. With that, I'll hand it over to David to begin the presentation.
Thanks, Yula. Hi, everyone, and welcome. My name is David Roth. I'm the Chief Marketing Officer here at Mobile Heartbeat, and we'll be guiding today's discussion. So let's start off by meeting our speakers. First is Kim Wagner. Kim is a senior clinical nurse informatics specialist at Richmond University Medical Center with over 20 years of experience in healthcare. Her career spans emergency department nursing, nursing informatics, information technology, applications management, and quality metrics. In her current role, Kim bridges the gap between clinical staff and technical teams, leading initiatives that enhance care delivery through effective use of health IT. Her unique combination of hands-on clinical experience and technical acumen enables her to drive impactful, patient-centered solutions across the organization. Next, I'm happy to introduce Dr. Jonathan LeBaron. He serves as the chair for the Department of Emergency Medicine at Richmond University Medical Center, where he leads both a Level 1 adult trauma center and a Level 2 pediatric trauma emergency department that treats approximately 65,000 patients annually. With his extensive background in emergency medicine and trauma care, Dr. LeBaron brings valuable expertise to one of Staten Island's critical healthcare institutions. In his current role, Dr. LeBaron continues to enhance the emergency medicine protocols at Richmond University Medical Center by implementing innovative communication solutions like Mobile Heartbeat across desktop and mobile devices. This technology has transformed clinical collaboration among care teams, driving operational efficiency and improving patient outcomes in the emergency department. Last up is me. As mentioned, my name is David Roth, and in addition to being the Chief Marketing Officer at Mobile Heartbeat, I'm your moderator for today's event. A little bit about me. I have a robust background in go-to-market strategies, sales enablement, growth marketing, particularly within the healthcare and SaaS sectors. In my current role, my focus is enhancing the company's marketing presence and driving growth through strategic marketing initiatives. My work not only supports the company's mission to improve clinical communication, but also contributes to broader advancements in healthcare technology and patient care. So, a case study on RUMC's communication transformation. Kim and Dr. LeBaron, to give us some context, could you share what Richmond University Medical Center is like and walk us through some of the key challenges you've encountered with patient care delivery, staff satisfaction, and communication between nurses and providers? Kim, can we start with you?
Certainly. Richmond University Medical Center is located in Staten Island, New York, one of the 5 boroughs of New York City. As you had mentioned, we're a Level 1 adult trauma center, a Level 2 pediatric trauma center, STEMI receiving, a stroke center, thrombectomy capable. We average probably about 160 patients a day. We have a pretty high acuity in our facility and have an admission percentage between 18 and 20%. As far as the challenges with the ER, it's extremely noisy in an ER. It's very difficult to communicate if you don't have a way to do so. And we certainly don't want to add to the noise by using the overhead paging system constantly to speak to each other. And as you mentioned, our expanding footprint, it became more and more challenging to communicate face to face.
Wonderful. Thanks, Kim. Dr. LeBaron, can you add to that as well?
Yeah, sure. Thanks, David. So, to give some context to the issues that we were having, our initial emergency department was around 15,000 square feet, which does sound like a bit pretty large, right? But when you imagine all the beds that are there, all the staff that are there, just all the space that's taken up by how we care for patients in an emergency department, we were generally right on top of each other. If we had something to say to somebody, we could yell literally across the room and they would end up hearing that. Overnight, that space transformed from a space of 15,000 square feet to a space of 35,000 square feet. We're going to get to the challenges that come to that next. Our initial challenges really in that small space were just closed loop communication was an issue. Did they hear me when I told them what I needed them to do from across the room? Timely communication was an issue. Oftentimes the nurse wasn't at the desk when I needed to speak with them. And me as a physician, I'm busy running around the department seeing other patients. And then the simplicity of communication as well. It's nice to have that dialogue back and forth with your nurse to make sure everyone's on the same page. But a lot of times, really just what they need is a note, patient asking for food. Can we get them food? Patient asking to use the restroom. Can you have someone go and help them use the restroom? And that can really just be done with a simple text message. Our previous system was notes on our trackboard, which obviously leaves a lot to be desired. And while that's okay to use for simpler communications and asks, like patient needs to use the restroom, it's not appropriate for things like, please don't give that medication. And that's ultimately what it was being used for because people had a difficult time getting in touch with the nurse that was taking care of the patient. So our communication strategy really relied just on one-to-one communication. And even in that small space, we saw that that was going to be a challenge for us as we were looking to expand to a space that was literally double in size.
Wow. Thank you both, right? You both described this environment and reminded us what it's like to be in the heart of the ED, the noise, the overheads, the challenge of communications as you go from 15,000 to, I think you said, 35,000 square feet. So that'll bring us to our next slide, which is a case study on RUMC's communication transformation and what changed. RUMC expanded, again, from a 15,000 square foot emergency department to a much larger facility. With help from CDW, Mobile Heartbeat was brought in as their trusted clinical communication solution to address an entirely new set of challenges. Kim, over to you to ask if you can speak first to these challenges.
Certainly. Obviously, the communication became more challenging as the staff was more spread out, making real-time communication difficult without having to walk quite a distance over to each other. And then, as Dr. LeBaron mentioned, they're in the middle of patient care, so they may not be even at the location where you're walking over to speak to them. It was definitely making it more difficult for the nurses to communicate with physicians, with each other, with the clerical staff, with the leadership team. And you certainly don't want to add difficulty into an already busy and very challenging environment.
Fair enough. And if you can elaborate, were there specific challenges that the nurses were addressing as a result of all that?
Certainly. When they needed to speak to the physician to have clarification of an order, let's say, or when they needed to speak to the leadership team to let them know that they needed to have some different resources available to the department, it became very challenging. So we definitely needed a communication tool to allow us to do that efficiently and effectively.
Fantastic. Thank you. So over to you, Dr. LeBaron. Can you give us an example of the impact of physicians and the overall clinical teams?
Yeah, absolutely. So as we mentioned, while we doubled our space essentially, and the communication platform, which was yelling across the room, was not going to be successful in that environment anymore. We had different areas in the department where different types of patients were being cared for. We had an area specifically for critical patients. We had an area specifically for more low acuity patients. We had an area for specific fast track patients that really should just be in and out. And because of that large geography that needed to still be covered by the same physician staffing, communication obviously became a pretty significant challenge. The biggest issue around an emergency department is really in timely communication. So we have anywhere from 13 to 20 patients coming in an hour. As a physician, I'm faced with new pieces of information, literally second by second. I'm someone who gets interrupted 5, 10 times, literally in a 2-minute span, to end up signing an EKG, to have a critical lab result pop back, to have a patient give me a need. and disseminating that information and making sure that my nurses get that same information that they need to critically care for those patients that are presenting is of the utmost importance. And so an issue that we were having with our current communication strategy was, one, it was very inefficient. Walking over to talk to a nurse takes a lot longer than picking up a phone and calling. Two, it was unreliable. While I could certainly call overhead and ask for a nurse to call back, that would then, of course, mean that the nurse then has to pick up the phone, give me a call back. It would have to assume that the nurse heard me call them overhead. And then it would have to assume that I'm near a phone that I can end up speaking to the nurse when they call back. And three, it was really not timely and could be misleading. We mentioned the comments on the track board previously. Those comments were limited in terms of the character space that you could end up having. And also, that piece of information, there's no way of knowing when that was placed. It's not timestamped. So what I said 5 minutes ago might not be relevant anymore. And again, as we had mentioned in the previous slide, a lot of critical information was falling there just because the first two methods of communication, either trying to call them overhead or walking to the bedside, took so much longer and so much variable in terms of the desired result that critical actions like don't give this patient that medication were now falling into that comment board piece. So we really needed a communication strategy that would allow for minute-to-minute communication, that would allow for closed loop communication, that would allow for time stamping of certain things, and that would allow for us on the provider side to recognize that the nurses had received that communication and were moving forward with that communication. And that was, what we came to Mobile Heartbeat asking, and that was ultimately what we ended up receiving once Mobile Heartbeat was implemented in the department.
Perfect. Thank you both for that. And you really set the stage wonderfully for the next slide. I do want to just take a moment to really re-articulate. Patient care was hampered by inefficient collaboration, as was explained, and the information flow, and therefore it left a critical need for implementing a mobile communication strategy.
The staff was actually very excited about the prospect of using the system. Obviously, having these issues of having the larger footprint and having difficulty with communication, they were eager for a solution. Mobile Heartbeat is great as far as the metrics and the analytical and administrative reports that it provides. So we were able to see who was using the system, when they were using the system, who was on shift, who wasn't. So when we did have some late adopters, we could focus our attention, see what their issues were, and really make sure we got them on board so that everybody would be on the same page.
Perfect. And Dr. LeBaron?
Yeah, and I would agree with Kim. I mean, our staff was really excited to have a communication platform. It was a known challenge moving into the space, and once we moved in and lived the space, the need for that device and that platform was very apparent, and everybody felt it, and everyone felt the same issues that I brought up, that I can't find the nurse when I need to find them. I don't have a reliable means of communicating with them, and us collaborating and working together well is critical to patient care and to making sure that patients get the care they need when they need it, and making sure that they can continue their process through the emergency department so we can keep seeing patients as they're coming in. So adoption in terms of our staff wasn't a huge issue. One, again, the need was demonstrated, but two, also the platform is relatively comparable to many mobile devices that they're already comfortable using. The workforce today is made up of people that have been using cell phones for quite a long time now. And the device itself is placed on an iPhone. It can be placed on your own device. And the staff really took to that. And it's very intuitive. It's not much of a learning curve if you're already someone who's comfortable using a cell phone, which again, at this point, the large majority of our workforce is using in their daily life already. So uptake was not much of an issue. And then once they began using it and could see how it really improved the care that they were providing their patients, continued use of it was really not an issue. Once you would end up demonstrating that this is critical to patient care, they're going to continue using it and continue to make sure that they have that available to them.
Fantastic. I'm just going to take a moment to summarize before we leave this slide. I really like how you piece that together, Dr. LeBaron, in terms of the sequence that you explained. What was key to adoption is that the staff, they needed help finding the right person or contact to contact. Then they needed the means. They needed a communication method to do that. And they realized that those things needed to go together in order to really improve, or in a more timely way, work with their patient and their patient cares. And I think that's highlighted on this slide, right? This was transformative to your operations, and this was a tool that created communication efficiencies. And at the end of the day, folks, whether intuitively or you coach them along the way and reminded them that really the goal here is the improvement in patient care quality, in the safety outcomes. And I think, directionally you're heading towards that in the conversation. And so I think that is a perfect place. It brings us to our next slide. So this is about efficiency gains, patient safety, task management, resource allocation. We want to take a moment to really describe, elaborate these benefits. So what day-to-day workflows have improved the most following your mobile heartbeat implementation? Kim, if you could start us out again.
Certainly. The collaboration between the team members is certainly one of the key factors that have improved because we can communicate efficiently, effectively, all have the same information at the same time. Obviously, the more efficient things are, the easier it is to run the department properly, which will lead to better patient outcomes and better care, as you said.
Wonderful. Thank you. Dr. LeBaron?
Yeah, I mean, everything that's listed on there are really the gains that we ended up seeing from implementation of mobile heartbeat. We go on and on about how it allows for timely communication, but that's really central. The majority of errors in healthcare are really around communication, lack of communication, and misunderstood communication. And what this platform allows us to do is to have those conversations in a quick and appropriate manner. If I need to get in touch with a nurse now, I no longer have to search different rooms. I no longer have to overhead. I can find them on mobile heartbeat. I can give them a call if it's something that we really need to discuss and talk through, or I can just put in a text if it's a simple yes, no question I just need an answer on, or just need some acknowledgement to make sure that they've seen and that they understood what's going on. Our nurses here are fantastic and they pick up on things a lot of times quicker than I do. And so if I end up putting in an order that doesn't make sense, they want to make sure they understand why that order is there before they end up giving it to patients. And on their end, a lot of time was wasted trying to find us, and now they have the ability to just quickly give us a call and make sure that they're back on the same page in terms of how we're treating a patient. In terms of patient safety, we work with a very ancient EMR, and it's nice to say that mobile heartbeat pairs well with that. Not that it's an old platform, but that it's really universal in terms of how it can transform departments and how it can be implemented in departments. But there are a lot of patient safety features that are not on our EMR, and unfortunately, we as physicians had to be a bit of guardrail to that. And that timely communication makes sure that those guardrails are in place and that a medication that shouldn't be given is not given if it was ordered erroneously, just to make sure that that was covered and that they're not going to give that medication. And so, like I was saying, our nurses want to make sure that they're not doing the wrong thing, so they're going to be quick to get in touch with us. In terms of resource allocation, you can imagine that if you're able to communicate about patients and deal with their complaints quicker, that you're going to need less staff to end up taking care of those patients. And it's not that we added staff, but it certainly made it felt like there was more work than what could be accomplished. And once you add in that piece that saves 5-10 minutes from everyone's communication, suddenly they have a lot more time to get the patients, take care of patients, and work through those patients. The other thing that more administratively to touch on outside of when I'm working on an actual shift is timely information in terms of what's going on within the department. Is our CAT scan down? Is there a type of test that's not running? With the broadcast feature, we're able to let everyone in the department know at the same time what's not working so that everyone's operating with that same piece of information. Information changes literally every 5-10 minutes in the department, and making sure that everyone understands what is and is not available is critical to making sure that the patients can get from point A of entry to the department to point B of either discharge from the department or admission to the hospital setting.
Fantastic. Thank you so much for that. I would also add, because you touched base on it, Dr. LeBaron, in addition to providing a smooth experience, a communication tool, in the hands of your users. We're actually known as an organization that does a stellar job with our integrations. So mentioning the integration to your EHR, we're known to do that as well with nurse call, telemetry systems, other items there. So that's something that we pride ourselves. So I really appreciate you mentioning that. But listen, I want to talk about the communications and patient care. So Kim and Dr. LeBaron, can you each give us an example of how mobile heartbeat eases communications around the delivery of patient care? And for example, are there specific patient scenarios where using mobile heartbeat help the patient to receive quicker and more efficient care? Kim, back to you.
As I had mentioned, we are a STEMI center, we are a stroke center, we are a thrombectomy capable center. So all these types of illness and trauma injury requires timely and efficient care. So particularly the broadcast messages are great to be able to have the entire staff know something at the exact same time, even if it's prior to arrival, because we typically get a notification before a patient comes in with one of those type of events. And there are certainly metrics to meet as far as those patients getting to the cath lab, getting to interventional radiology, getting to CAT scan, and it helps us to deliver more effective and efficient care.
Thank you. How do you use broadcast messaging to improve staff response times around urgent issues? I'm going to turn that to you, Dr. LeBaron, if you can.
Yeah, certainly. So one of the things that Kim mentioned up front was that we're a thrombectomy capable stroke center. And one of the things that we were challenged with was making sure everyone knew which of our patients were actually going to go for a thrombectomy. And it seems very obvious, that should be communicated from the second it's known. But unfortunately, a lot of those decisions happen outside of our department and are funneled through to one person, that one person typically being the physician. And the physician's busy juggling, this patient also needs TNK, so I have to provide that to them quickly. They need to have all these labs in place, so they need to make sure that's done correctly. They need to make sure that they're connecting the neurointerventionalist with the patient so that the patient can get consented and get taken for their thrombectomy procedure once that's ready to happen. And while the physician has all those tests, the nurse certainly has a bunch of tests that they need to be aware of as well to think that does the patient need a Foley? Does the patient have a second point of access? Who does that nurse need to hand off to make sure that the next step occurs? And we ended up seeing pretty significant delays because the physician piece was aware that the patient was going to thrombectomy, but the nurse wasn't aware that the patient was going to thrombectomy. The charge nurse wasn't aware the patient was going to thrombectomy. The clerk wasn't aware the patient was going to thrombectomy. And all of these people are very key in making sure that that patient is ready to go to thrombectomy once the team is ready to receive the patient upstairs and take care of that patient to remove the clot and treat them with the stroke. We use mobile heartbeat to use their broadcast function to make sure that not just the care team was aware of that, but that the entire department was aware of that. And it really streamlined things in making sure that everybody knew the same pieces of information at the same time. And we did see some improvements in terms of our door to groin puncture for those patients, which is obviously critical to saving brain and helping them have a better outcome with their treatment.
Perfect. I'm going to ask you both the same question in a moment. Dr. LeBaron, I'm going to ask you second, right, to think about what's the biggest communication challenge today in the ER that gets solved for. But Kim, I'll start with you. The broad heading here is, how does mobile heartbeat support your team in managing clinical responsibilities and ensuring follow through on tasks? So Kim, are there any metrics or organizational goals that mobile heartbeat helps you achieve? Patient satisfaction scores related to stroke, door to balloon times, so forth.
Honestly, you could speak to all of them. As Dr. LeBaron just mentioned, the door to puncture time, time is brain. Same thing for the STEMI patients. The door to the balloon time for those patients is extremely important in the cath lab. The trauma patients, code HIP, that patient has to be in the operating room within a certain metric of time. And of course, patient satisfaction is going to increase when we're communicating more efficiently. The patient is getting what they need quicker, and that's going to improve their satisfaction.
Wonderful, thank you. And Dr. LeBaron, this is really a targeted question, but feel free. We're asking, what's the biggest communication challenge today in the ER that mobile heartbeat helps solves for?
Yeah, I don't want to glamorize what I do, but we are asked to multitask a lot. We're given a lot of pieces of information. We're taking care of a significant amount of patients. A lot of those patients could be critically ill, and there's a lot of tasks that we have to mentally juggle. And humans in general just aren't good at multitasking. We're very good at doing tasks very quickly and doing them serially, but doing 20 things at once is impossible for pretty much everybody. And so when you break that down and realize that your tasks really need to be done and finished in order so that you can move on to the next thing and make sure that you've tied that issue up and either made sure that that medication is going to get administered or made sure that that nurse is going to draw that lab or made sure that patient is going to make it to CAT scan. That's where you realize how critical something like mobile heartbeat is. You know, instead of getting a task that involves communication, that involves me then having to do three different things to make sure that that nurse or that clerk is aware of what the next step is, I can pick up a phone, I can call someone, and it's done. I can move on to my next task without having to keep that on the back of my mind that that still is not done, that needs to get done. And that's not going to reflect in one specific number because it's really ubiquitous throughout the department, but it's going to show up in the sense that, you know, after this is implemented and after we solve the communication issues, you know, we should hopefully expect to see less bad outcomes. We should hopefully expect to see better patient satisfaction because those patients are taken care of in a more timely fashion, and everyone has the same information and everyone's communicating the same thing to the patient so they don't feel like we're not working together. You should hopefully see gains in terms of your door-to-doc times, your door-to-dispo times, because the inefficiencies that existed prior to a communication platform like Mobile Heartbeat don't exist. You know, we're all on the same page, we're all communicating effectively, and we're all communicating efficiently. So there's not one thing I could point to, but I will say that globally, something like this does definitely help move the department forward significantly.
Perfect. Thank you. Again, reiterating what you said, really, this communication is required for everyone. What you described is critical. And added to that, I want to focus on really how that critical communications is also happening for resourcing, administrative needs. Kim, I'm going to start with you. Can you describe some specifics around mobile heartbeat, how it's used for resourcing and administrative needs?
Certainly. I use it from an operational perspective quite often. It allows me to get messages out to the staff about any new initiatives that we're implementing, any changes to processes that are already in existence, practice alerts for the staff. And it also gives me a certain level of compliance measurements because I'm able to see that the message was read, at what time it was read. I can see who was able to ingest the information. So it's almost like saves you the time of going around and doing a sign-off education, which everyone's familiar with in healthcare. We're able to do that through the electronic platform, which is a great time saver. And the staff has it to refer back to. So if they were busy at the moment that they got the message, it's still there in their device for them to look back, get that information again when they have time to ingest it.
Wonderful. Dr. LeBaron?
No, I agree with a lot of what Kim said, and I didn't even, realize that she was using it in the sense of communicating with the nurse and doing a lot of just-in-time training for the nurse. I mean, I think that's fantastic, and that does help cut back on some time and gives them an additional resource for a lot of changes that end up happening within their day-to-day work to make sure that they know we're doing a new process, like make sure you remember how that's done, just making sure you have that extra level of security there to that extra level of information there to end up giving the nurses what they need to take care of patients is incredible. For me, in terms of an administrative standpoint, I use it much more so just to make sure people are aware what systems are working, what systems aren't working, and again, to make sure that just everyone in the department is operating with the same level of information in terms of what they need to get done to do their job. Um, yeah, I haven't leveraged it as much in terms of a physician education piece, but a lot of what I end up needing to educate my physicians on ends up taking a bit more than the space I can end up putting in the mobile heartbeat app there.
I just wanted to mention too, but our staff has certainly been able to feel that their leadership team is more available and accessible to them on a day-to-day basis, because it's not like they have to leave the floor, stop what they're doing and go report any issues or to get extra resources if needed or whatever's going on. They have the availability to speak to us directly, so from where they are on the floor.
Outstanding. Thank you. So now, speaking of more towards patient care, can you tell us more about how you use mobile heartbeat to ensure the patient is getting the care they need? Kim?
I think the communication allows for a better continuity of care. The nurse, the physician, the techs, everybody's on the same page. If the patient is waiting for something, we all know it. The next person who makes contact with the patient can make that happen for the patient, which will in turn obviously provide better care for them, provide better satisfaction level to them. And also, if somebody's in trouble, they went into a patient, something is going on, they can immediately contact the people who they need help from to get that patient cared for more effectively and efficiently.
Thank you. Dr. LeBaron, anything to add?
No, I touched on it a bit earlier, but I would just echo what Kim says. In reviewing a lot of patient surveys and comments from patient surveys, a lot of what they don't like is feeling like everyone's on a different page and everyone's giving them different pieces of information that it doesn't feel like the team is cohesive at all. And what this allows us to do is be cohesive when we're engaging those patients for the hours that they're in the emergency department. And that goes a long way in giving the patient a sense of confidence that we have them, we understand what's wrong with them, and we're all working together to end up treating them. So I would echo that as really the biggest gain that the patient's seeing, aside from all the background stuff that we've talked about, that sense of confidence that they're getting from knowing we're all on the same page is tremendous.
Thank you. And thank you both for that. We're going to transition now to the next slide for a question we often ask to our own customers to make sure, and I mean that from a product side, from a professional service side, to make sure that everyone is receiving the maximum value from the system, and so that we're always in alignment with the benefits. And so the question is, what would happen if mobile heartbeat was removed at your organization for a day, or just hypothetically for a moment? And the point here is how integral has mobile heartbeat become to your daily operations, and what impact would you feel if it disappeared tomorrow? Dr. LeBaron, we're going to start with you.
So we'd end up taking a step back to where we were, 3, 4 years ago, where we did not have this platform. It'd just be exacerbated because we're in a space that's much larger than the space that we previously were. So all the gains that we made in terms of communication efficiency would be lost. All the extra support that the nurse feels from knowing that the physician is just a call away, all the security that the physician feels from knowing that the nurse is just a call away would be lost. And we'd end up dropping a lot of things in terms of making sure testing is getting done, making sure that the physician's aware of certain things that the nurse ended up seeing at bedside that they haven't communicated with them. And ultimately, there's a good chance that it could end up resulting in patient outcomes just because, again, not everyone's on the same page at this point and not everyone's communicating as effectively and efficiently as they should be communicating.
Perfect. Thank you. And Kim?
It certainly would disrupt their workflow. It's become an integral part of the workflow. It is how we, address each other. It is how we get things done. So for it to go away suddenly, it would certainly impact the quality of the workday for the staff, the quality of the care for the patient, and the quality of the communication, which can lead to, as Dr. LeBaron mentioned, poor outcomes. And that's certainly not something that we would want to do.
So big question here, I know, but to Kim and Dr. LeBaron, what does all this mean, right? So how do you see the use of a clinical communication platform evolving at your organization? Dr. LeBaron, I'll turn it to you first.
Yeah, I mean, we'd really like this to go house-wide. So a lot of the communication challenges that we have downstairs prior to mobile heartbeat are only amplified as that transition upstairs occurs. I'll leave it to Kim to talk about what that could potentially mean for nurses who are taking care of patients where their doctor, forget being in the same department, having to hunt them down in the apartment, but is floors away from the patient or sometimes not even in the same building, right? In terms of me as a physician, if this was expanded house-wide, I'd be able to have my accepting team on the same bit of communication that I've been on the whole time so that they're aware of what's been going on with that patient up until the point that they're handed off to they'd be able to communicate with me more efficiently, more easily. So if they had any questions at that time of handoff, did we give the patient this? Have we considered this? What testing have we done to rule out this diagnosis? All that could be done in real time and prevent a lot of second guessing that would occur after that handoff had already occurred, and after they were already taking care of that patient. It would end up helping in terms of consulting. So at this point, that consultant conversation is really a one-time bit of communication. But much like my nurses with the patients who are communicating with me, the patients and what's going on with them evolves on, an hourly basis. And so I might have a new lab test back that would be of interest to my consultant, but having to page them out and having to communicate with them again ends up being very difficult. And a lot of times that often ends up getting missed. And there's always the potential that a patient's trajectory could have been changed if they had had that information in a timely fashion instead of when they ultimately come in and see the patient hours or a day later. So it would definitely end up helping in terms of workflow improvement and ultimately hospital flow in terms of patient getting in and out. And then, of course, it would help with patient satisfaction as well. If the patient feels like that handoff was done in the best manner, then when that physician's coming down, they should be talking to them and saying, I spoke to your doctor in the ED already, understand exactly what's going on you're here for this, and don't worry, we're going to get you through this and take care of this, instead of starting the whole history and physical again and going through everything and coming up with their own formulation of what's going on with the patient, where the patient then feels like, did I waste these first 4 hours in the department? Like, what have you been keeping me here so long if this is where my treatment finally actually starts?
Wonderful. Thank you. Kim?
From a nursing perspective, especially being an emergency department nurse, we have two different types of patients that we care for. We care for those patients who are actually ED patients while they're here and they're still under evaluation. But we also care for a good deal of admitted patients who are waiting to go to the floor to get a bed on the telemetry unit or in the surgical unit or wherever they may be assigned. And the physicians who are caring for those patients aren't necessarily in the ER. So as Dr. LeBaron mentioned, if we could get this to go house-wide, all those same issues that we were able to solve within our department, we could start to solve within the entire facility. I could really see it improving outcomes, being able to collaborate as a team beyond the emergency department through the entire continuity of care. It would definitely optimize everything for the patient and increase satisfaction and just better care.
Wonderful. Thank you both for that. I guess I just have one general question before we go to really kind of open this up to more shared insight that you might share with other viewers of this webinar. But Dr. LeBaron and Kim, any final thoughts on the importance of this real-time communication, benefits of having a customizable platform, anything you'd want to highlight as a true differentiator?
I can certainly speak to the customization allows us to, sometimes we say RUMC. Every facility has their own unique challenges. So it does give you the ability to really address your specific challenges in your facility. And the versatility of the platform being able to either be on a shared device, on the BYOD, or on a desktop version, which is what we use for our clerical folks, because it makes the most sense for them. It really gives us the versatility to be able to address each type of person who's part of the care team or part of the team in general, and give them the best tool to be able to efficiently and effectively communicate.
Fabulous. Dr. LeBaron, not to put you on the spot, but the question again was around the real-time communications, benefits of a customizable platform, even related to patient care impact. Just want to see if you want to add anything or if you have a RUMC story of your own.
No, I would agree with Kim. We've gone pretty much on and on about how how important communication is to patient care. And ultimately, at the end of every RCA, it comes down to communication. Something wasn't shared with somebody, right? Or something wasn't relayed properly to somebody, or someone just didn't understand something. So the importance of communication is key. But I think what Kim touched upon is really what separates Mobile Heartbeat from other communication platforms that you might be looking to use. We used Practice Unite prior to Mobile Heartbeat, and it didn't really feel like a true integrative medical solution in the sense that it didn't provide the type of like real-time communication that we were looking for. It did not provide nearly the customization that Mobile Heartbeat provided. And the mobile heartbeat folks are fantastic just in terms of making something work when you ultimately need a solution that really depends on communication. They've been great with working us in terms of dynamic roles, in terms of creating broadcast functions, and they're really there to support what you want to get done in a department that's going to make sense for the workflows that you have built out because we know that, if you've seen one emergency department, you've seen one emergency department. Everyone's got a different way of getting things done. And Mobile Heartbeat is really fantastic in terms of doing their best to integrate to what you need for success.
Fabulous. Well, I want to thank you for the overview, for sharing your experiences, for walking us through, the elements of the challenges you faced and how you added communications to solve that and hit all these points in terms of what all this means. We do have three additional questions that are really more open-ended, really asking you about your insight that you would share with all the viewers of this particular webinar. I don't know who wants to step up on either of these three questions, but I'll just tee up the first one, which is simply, where does clinical communication fit with health systems that truly want to be cutting edge?
I will take that one if you want.
Great.
It's essential. There is absolutely no way that you could be cutting edge without being able to have a clinical communication tool. And as Dr. LeBaron was highlighting, other products that we've used in the past, not that you can't communicate through them, but they're not designed for a clinician. Mobile Heart is really designed for the clinicians, and also its reliability, where the downtime is almost nil, unless it's expected for an upgrade or something along those lines, is great. It's something you can rely on, and it's an essential tool.
Wonderful. I'm going to move on to the next question, unless you want to add anything, Dr. LeBaron.
That was good.
Okay, can you speak about how clinical communication platforms provide sustained value over time?
Yeah, I mean, I can take that one, although I'm sure Kim has some insight as she's works more in terms of our analytics and in terms of the back end of currently keeping us upgraded and keeping us with the latest functionality. Um, but really, communication, the need for communication does not change over time. And Mobile Heartbeat has a lot of customizability features that allows them to really integrate with any future workflow in terms of getting the right people on the line, in terms of how that's communicated, whether it's phone call, whether it's text-based, in terms of whether it's just one-way communication out, or in terms of whether it needs to be something that is a real dialogue. They're very good about about updating themselves and making sure that they're a platform that's gonna work for your future EMR, that's gonna work for your future bedside monitoring systems. They're very good at making sure that they can integrate with all those pieces.
Wonderful. Kim, anything to add before I move to the next question?
I'm in touch with the Mobile Heartbeat team at the longest every 2 weeks. I've gotten to know them so well over the last 2 years of us having this system in place. They understand our challenges, and they bring more to the table to offer us different solutions. We work very well together. They're always available if you need assistance. And I think that in the value over time in that, having a relationship directly with the team from Mobile Heart, it has been great for us.
Thank you, Kim. I appreciate you adding that. That's actually music to our ears, right? You mentioned the ability to customize the solution, and we like to partner truly with every one of our accounts, every one of our customers. And a lot of people say that they partner in terms of approach, but we as an important mission critical communication tool, we value that partnership, and so I appreciate you adding that. Okay, last question. The ED is known to be essential for patient workflow management. Which elements of the Mobile Heartbeat platform do you view as essential?
I mean, text-based and communication, text-based and voice communication are really essential in terms of moving things forward. The ability to create different group texts because you don't know who you're working with on a regular basis really helps. Our ED at this point uses more of like a round robin system in terms of addressing patients and seeing patients, but when we eventually move to a place where we have an urgent care team, getting your urgent care doc and your urgent care nurse on one communication platform that they can be in contact regularly works out very well in terms of patient flow. Having an open line of communication with your trauma nurse or your resus nurse to make sure that those very critical patients are addressed very quickly is a huge help. And so really both those, I wouldn't be able to separate which one's more important because again, a lot of times you do need a full dialogue and that verbal communication is good, but just the ability to really customize your channels in terms of who you're communicating with is super helpful.
Perfect. Kim, any thoughts to add?
Certainly. The broadcast messages, I think that they're great. The fact that you, as one person, can communicate to the entire team, to the entire group at once is essential, especially in a place like the emergency department. One person receives a phone call that we're getting a mass casualty incident. Everyone needs that information immediately, so the one-to-many communication is great.
Awesome. Thank you both for sharing your time, your insight, especially for what it means to help educate the viewers of this webinar. And with that, again, my thanks and thanks from Mobile Heartbeat and the team here. Eula, over to you.
At this time, we have to wrap up. Thank you to our speakers for the wonderful presentation. We would like to thank our sponsor, Mobile Heartbeat, once again for their support of this webinar. And to our audience, don't forget to take our brief evaluation at the conclusion of today's event and share your thoughts with us. As a reminder, you'll receive an email within 24 hours to rewatch the on-demand recording of today's session, and it'll be available in the HIMSS Resource Hub for a limited time. So feel free to come back and watch at any time. Thanks, everybody. Have a great day.